Good evening. Thank you for joining us for the second session of the Bowie Workforce Development and Life Skills Training Program. We're going to wait a minute or two to give everyone time to log on, and then we will start with the life skills presentation on managing time and money. Thank you all for joining us this evening. As always, if you have a question, feel free to raise your hand and we can unmute you, or you can type it in the chat and we will respond. And I appreciate you guys all joining us again this evening. All right, I'm going to turn it over to Rhonda and Amanda.
Good evening, everybody. Good to see you all back here this week. Guess we didn't bore you too much last week, so you came back. So I'm really glad. I hope you're getting something out of this program. I'm Rhonda Simon. I'm with the City of Bowie Youth and Family Services. Again, we primarily do family counseling, but we do have outreach programs such as this with the community. And this is life skills for transitions. And with me tonight is my coworker, Amanda Pumphrey. She is our community coordinator, and she'll be joining us tonight.
Hi, everyone.
I'm gonna share my screen. Oh, here we go. Did anybody have any questions from last week? Did you come into tonight with any questions? You can unmute yourself to talk or put something in the chat box. Remember, I don't want to talk to myself all night. All right, you see my screen, Amanda?
Yes.
Okay. All right. So this is life skills. Oh, yes, Jacob. That's my next PowerPoint, the job fair. This is our transitions course with life skills. Also, so there's the QR code, takes you to the job fair webpage, but on the webpage, you will see where it says young adults register here. So that job fair registration is not required, but we are having a $50 Target raffle for a Target gift card for people who pre-register and check in the day of the job fair. So then your name will go in a hat and we'll pull out a drawing for the Target gift card. So that's for pre-registering, but it is not necessary to register to show up. Please tell all your friends, but you can hit this QR code and register. It's Saturday, March 26th. That's this week. Doors open at 9 a.m. It's until 12. We have 29 employers and some really good employers coming. So, and again, on that webpage, you can see every employer that is participating this year. So I hope to see you guys. If I do see you, or if you come and you see me, I won't see you because I don't know you, what you look like, please come and say hi and tell me that you saw this in this program. I appreciate that. I'm gonna leave that up there just long enough. If you guys want to see it again at the end of the presentation, just let me know. I'll bring it back. Thank you for that reminder, Jacob, and thank you for remembering. Okay, so our agenda is, this is a very participatory program. So I will ask questions. I will look for your responses in the chat box. And again, of course, you can unmute yourself and talk to me. You have a student guide. We do use the student guide. We don't go through it like in chronological order, page by page, but there are certain exercises that we will be taking a look at. I hope tonight that you get an aha moment, which is your light bulb goes off, right? It's like, oh, I never heard that before, and I'm going to put that in my toolkit and use it, you know, the next time I need this information. I want my aha moment too. So what that means for me is that you have to unmute yourself and talk to me so I can learn something too. I always learn something when I'm doing this course with young people, which I appreciate. I appreciate y'all keeping me up to date on what's going on out there in your world. Tonight, we are going to explore the relationship between our priorities, our values, our goals, and managing time and money. I think last week when we did our goal setting, I mentioned that a goal should be important to you. You should know why this is my goal. And so tonight we'll explore some more of those aspects of, you know, you getting to know yourself. What are your values? What are your priorities in your life? And how do they help you manage time and money? Okay, so this is again, a Starting Student Guide, page 26, Activity A. And I wish I had it. I don't have it because I forgot my book. It's okay if you're listening and I missed something out of that activity and you could let me know, that'd be great. So managing time and money takes a lot of prioritizing, right? It's the act of placing items in their order of importance based on our values, our goals, and our needs, and recording ways of how you spend your time and money and prioritizing them. So there are a lot of apps for time and money management. So if you Google it, you'll see a ton of apps that can help you do this. I'm definitely old fashioned and I definitely like pen and paper. Oh, I'm not too old fashioned. I do pay my bills online. I do have, I do mobile deposits and mobile bill pay and that kind of thing. But when it comes to my goals and my budget, it's mostly written out and I like to see it so I can stay on top of it. Just as with my goals, when I see my money, you guys never have to balance a checkbook. That's wonderful. But when I see my budget, I know where my money's coming in from and where it's going out to. And that's very important to money management. All right. So I have a question for you guys. If you can what do time and money have in common? Put it in the chat box if you want. Unmute yourself and talk to me, but I definitely want you to answer the question. I hope you guys are comfortable with the silence. Okay, so there's some things coming through in the chat box. Both are valuable. Yep. Both can be prioritized or wasted. Very good. Both time and money is something people always want. Yep. They both take time. They both can be lost. They're both important. Very good answers, guys. Yes. With time, you can build money, and with money, you can save time. Okay. I mean, I'd like to know how you save with money. How would you save money with time, Jacob? Because I know how I would. Curious as to how you would. And you can unmute or just put it in the chat box. You guys all, anyway, no wrong answers here. Time and money are both resources that end, right? Because all of our time is going to come to an end someday, and when that happens, our money ends as well. So that's what time and money mostly have in common. But you guys, had a lot of good answers. With time, you can like you spend less of your time working and retire early. Yes, that's really good. I was thinking too, Jacob, that so recently I'm getting ready for it's a grandbaby, but we're having a baby shower. And one of the ways that I think I save time with my money is that I can order online and have it delivered to my house. Same with groceries, same with food. So this is a lot of things that we all learned through the pandemic. So in one way, that's how I read your answer, that I can save time with my money, right? Because now I'm not running to the store, although I spent a little more money because I had to pay for shipping. So, okay, thank you. They're both important. They're both can be wasted. Thank you. And yeah, and you can't get them back, right? So once my money is spent, that money's gone. Once my time is spent, that time is gone. I cannot get those things back. How do you think prioritizing our time and money will affect the way we use them? And then what happens if we don't prioritize how we use time and money? You can answer me in the chat box, please. You can run out of both. Mhm. And how does not prioritizing, because we would be Anderson, would that be wasteful then? When you say we could run out of both? Mhm. If you don't prioritize them, you can lose control of them. Yes, Jacob. You can misuse both. Yep. Didn't make the most of what you had. Yeah. You could miss opportunities. Yes. Very good. So, yeah, so prioritizing, managing our time and money, budgeting, even you can even budget your time, right? Because there are, we talked last week about our goals. Like if we had a big project to do, we could budget time to do that. I'm going to work from 4 to 5 on that particular thing. And then that way, and set timers. And that way we're not wasting our time. Before I move on, just for fun, what do you think you guys waste your time doing? What's your biggest time waster? Just for fun. Your phone. Yeah. Watching TV or reading. Yes. Watching TV, reading books. I don't think so. Eating Pop-Tarts and playing video games. Yeah. Instagram. Yep. Yep. For me, it's like Facebook and I get on into those videos. Oh my goodness. Next thing I know, an hour of my time is gone. It absolutely drives me crazy. It can go by so fast. Okay. Thank you guys. Appreciate that. I don't think reading books is ever a waste of time. So I'm gonna have to say no on that one. But the TV watching definitely can be a waste of my time. I think TV is brainless and reading is not. So even if you're reading for fun. Okay, so student guide, page 27, activity B, we are going to be talking about scheduling. So now we're talking specifically about time management and how managing our time can support what's important to us. So steps for scheduling. So let me see. Identifying what's important. Identifying what you want to accomplish in a certain amount of set period of time, listing all of your activities and how much time you spend on them. So in the book, what you have is pen and paper, of course. But like I said, there are a lot of apps out there, and I can't think of one off the top of my head, and they don't have my notes in front of me. Does anybody, Amanda, do you know of an app?
Not off the top of my head either.
Okay. All right. So, yeah. So, but if you Google it, you would find apps to manage your time and money. So list your activities, how much time you want to spend on them, prioritize the activities according to your goals, your needs, and your values. Plan a schedule to maximize the use of your time and minimize distractions. So I think I mentioned this last week too. I could, if I knew I really wanted to relax a little bit and go through Facebook, I could set a timer and give myself 15 minutes if I really, was on a tight schedule, but that would be like my break time. And I could set a timer for that. And then evaluate your schedule to see if you need to rearrange or eliminate. Okay, so what they give us in the book is this example. This is a weekly schedule. So this is the number of hours that they spend doing, going to school, going to work, hanging out with friends, sports or games or practices, homework, and TV games and videos. This can be done prior to, so Mark says timers are difficult mostly because you don't want to listen to them. Yeah, very true.
I did think of one app actually, Rhonda.
Okay, yeah.
In response to that, I know there are some apps out there, I'm not sure of the names, but that you can block the app or like set a timer for how long you're using a certain app or website. Those
Is there an
definitely
app for
do.
that, or is it in the Instagram app or the Facebook app?
It's a separate app for that.
Oh, okay.
Yeah.
Yeah,
I'll have to look up the name.
I appreciate that, but I really don't want an app telling me what to do. That's just the honest truth.
But if you can't listen to a
Yes.
timer, sometimes it's helpful to have that hard
That's
cut off.
true. That is true. Yeah. Okay, so this particular calendar schedule, you could do a couple of ways. You can write it out prior to doing these things, or as you do things, you can keep a log, right? So, and I've done this before just to see where my time goes. And also, I think on apps like Facebook and Instagram, there's also inside of them, you can get in there and see how much time you've spent on them, which could be an eye-opening if you just wanted to check on yourself, like, oh, how much time did I spend on Facebook or Instagram this week? And then you can get on the app itself and find that out. I was just looking at that the other day. So like I said, anyway, you could do this prior to, since you know what your schedule is going to be, or you can do it as you go. Just keep a log of what you're doing. And then you can find out, sometimes time goes by and we're like, oh my gosh, what happened to my day? When you're keeping a log, then you can really evaluate where I spent my time and where I would like to make changes. And I've done that before. So sorry. Oh, here's the exercise. Sorry. We have 12 hours. That's our max. And the rest of our 12 hours is going to be spent sleeping. But in your day, you have a total of 12 hours, right? And now we're budgeting time. So you have to add 2 hours for a math tutor, which puts you at 14 hours on Tuesday, Wednesday, and Thursday. And that's not what we want. We want to stay at 12 hours. So, and just no wrong answers here. You need to take an hour somewhere else in your day, whether it's the sports and games, studying, or video games. Where would you take your hour or 2 hours away from so that you could add math tutoring? And did you guys understand the question? So I want you to tell me where you would take away time on Tuesday, Wednesday, and Thursday so that you bring that 14 down to a 12. So you have to take away 2 hours from somewhere else. And I want you guys to tell me where you would do that. Okay, Anaya said hanging out with friends. We can make that up somewhere else. An hour from homework and an hour from friends. Adriana, thank you. Adriana, that's my middle name too. Anyone else? That's 2 out of, many people are here. Oops. Okay. All right. And this is just an example. So like I said, there's no wrong answer. The idea is that I need to bring my 14 down to a 12. And then and this is again in your books. So this is your exercise, is that you would, one of the things we talked about was prioritizing. So the priorities over here at the end, and you would set that priority, right? So math tutoring, we set it as high when we need 6 hours a week. And we set watching TV and video games at a low priority, and homework medium, and sports and games are medium. Again, no wrong answer here. This is what you're supposed to decide what is important to you, right? You kind of have to go to school but you don't have to go to work. Maybe you don't have to go to work 12 hours a week. You could, so I don't know, maybe you do. But I'm just saying like that'd be you to decide what your priority is. Any questions, comments? Okay. Gonna want you guys to answer these questions. What are the advantages of keeping a schedule? And what happens if we don't schedule our time? Okay, so there are at least 14 of you on here. And so I'd like to hear from you all, actually. I meant games, but I think you got the point, Adriana. Yeah. Yes. Okay. Okay, thank you, Manuel. I get that. I appreciate that feedback. Manuel said everything is easy to understand and it's all organized. Being kept up to date on things. Yep, that's an advantage of keeping a schedule. Anaya said better time management and more productive. Yep. If you don't schedule your time, you could end up wasting time and forgetting things. Yes. And you definitely will be more productive, more disciplined. Keeping a schedule forces you to be disciplined. Yep. Very good. Yes. How many of you already do this? Just raise a hands. How many of you already do something like this? And I can't. Okay, thank you, Jordan.
We have at least 2 people who raised their hands.
Oh,
Maya
okay.
and Mark both raised their hands.
Okay.
And Jasmine. Thanks,
Okay.
guys.
Yeah. And Adriana said, not a strict schedule, but I keep a list of activities I need to do. Very good. Yeah. Yeah. I have to, sometimes I do when I go really, sorry, Manuel. Sometimes I do when I go really off track. Okay. Gotcha. Yeah. Okay. Do you guys keep, raise your hands? Like I use my phone, calendar, and I set like the timers on them. So I really like that a lot. It keeps me on task. So that even if I am distracted by Facebook, I'll get a little notification that says, hey, in 10 minutes, you got to log on to workforce development. So that's an app you could use, your calendar, Google Calendar, or the calendar, I think it's Outlook, Microsoft Outlook, came with my phone. Okay. All right, that is time management. We are going to talk about budgeting with our finances. And I have this poll, but you guys can just put in the chat box. I didn't set it up as a poll, so just put in the chat box 1 through 5, whichever one is the truest answer for you. I regularly keep a budget. I try to keep a budget, but not consistently. I spend my money before I have a chance to make a plan for it. I have parents. What do I need a budget for? And what's a budget? So give me 1 through 5. Okay, got a 3 and a 1. Thank you. Lots of 2s. Okay. So, so lots of 2s. A 3, 2 and 3. Yeah. So it's the nice thing about budgeting is that, sorry, I got distracted. Nice thing about budgeting for our money is that, you plan for it. And then again, budgeting is not for the faint of heart. I'm be honest with you. It takes a lot of discipline to budget our time and our money. It is, when we first started budgeting, like writing it down, what comes in and what's going out and prioritizing our expenses, it's not easy. I'm just going to say that. So if you haven't been strict about it, it takes some discipline to live that way. Because it's a lifestyle, not a one-time thing. because our money and our time changes as we change. And you get new jobs, you make more money. So, everything has to evolve. And budgeting involves planning, and it doesn't matter if you have 10, 100, 1,000, or 100,000. If you cannot budget and manage $10, you cannot budget and manage $10,000. So that's just life. So the quicker you get a handle on how you're going to manage your money as young people, really the better off you'll be. And I think somebody did mention, retirement early, and you guys have that opportunity as young people to learn these things and then practice them. Okay. And again, so it's about what's important, right? When you're talking about budgeting and time or money. We're going to talk about a few categories of expenses. And okay. And let me check who's keeping the clock on me, okay?
It's
All right,
6:26. Yeah.
Yeah, thank you. Okay, so in a budget, so you'll list all your financial resources, all the income and all the expenses. So anybody ever really do this before? Just simple yes or no if you've ever, and I know you guys are young and you would say, well, I don't have any money, but you're never too young to learn how to manage your money. And because I noticed none of you answered the question that you have parents and so you don't need a budget. But do any of you, Jordan said yes, do any of you have a job or you have your own income? Okay. Some have had jobs, some do now, and some not yet. Okay, it's all good. Okay, so money management. We identify our expenses. So a fixed expense includes the regular expense. It's just how it sounds. It's fixed. It never changes. Our car payment, house payment, so mortgages, or if you're renting, your rent payment is a fixed expense. So anything that's not going to fluctuate month by month. So that's what a fixed expense is. So maybe your cell phone is a fixed expense, or maybe they used to fluctuate a lot more than they do now. Nowadays, a lot of plans are fixed, but used to have to pay for minutes. So I don't know if any of you had to deal with that, but that's way back in the early days of the cell phone. We literally had to pay for minutes. Just when my kids had cell phones, and my daughter racked up a $600 cell phone bill. God, going over those minutes. Oh my God. Exactly. Oh my goodness. And now cell phones have come a long way, so have their plans. So your cell phone might be a fixed expense. Variable expenses are regular expenses that fluctuate according to usage. So a variable expense might be gas in my car, food. It could be your cell phone, right? It depends on the plan they have. So that is something I pay for. Food and gas is the number ones that come to my mind in my car gas that definitely fluctuate with usage and the world, right? Because we've all seen how, maybe you guys aren't paying attention, gas is phenomenal these days, and food has gone up because of the pandemic some, and we've had shipping problems countrywide. So a lot of our food and gas expenses has fluctuated, which can be a pretty big deal, especially in what we've been through in the past 2 years or so, and with those fluctuations. So that's a variable expense, something that we use regularly that fluctuates, the charge and the usage fluctuate. A discretionary expense includes a non-essential item and it's essential but unplanned. So an emergency, my car breaks down, right? That's an essential but unplanned expense. And those have to be planned for as well. So, so some people have a savings plan, and they have it for a different number of reasons, right? I'm going to save to play, right? So let's say out of my paycheck, I'm putting 10% in a save to play. When I'm ready to go out, when I'm ready to, I don't know, go shopping, it's a save to play. I want to play, that's my money. I want to go on a trip, that's what I'm saving that money for. And then save for emergency items. So then I might decide another 10% of my income is going to be saved for emergencies. My car breaks down, something in my house goes wrong, those kind of emergencies. That if I don't have a plan for those emergencies, then that's going to be a real problem. If my car breaks down and I have no money, then what am I going to do? Any questions about that stuff? Did you guys understand fixed expense, variables, and discretionary expenses? And I would like each of you to give me at least one example in your life that, or maybe you hear from your parents, or maybe when you're in it, you have your own money, like what would be your one of these three expenses: fixed, variable, or discretionary? What would you use your money for? So for example, my example is my hair. And I say this all the time. So I remember my husband and I were young and we decided we were going to budget, and he was fussing about how much money I spent at the hair salon. And so at that time I said, well, it's a variable expense because it goes up and down, but it's important to me and I'm never going to not spend money on my hair. So we put it in the budget, and I have a hair budget. You could have a nail budget or a shoe budget if you're a shoe person. So thank you, Anaya. Her fixed examples: rent, and discretionary is clothes. Is that what you're saying? Yes. Okay. And see, I would put clothes. I would budget for, like I said, the pay to play, and that would be part of my budget for clothes. But I would definitely like budget clothes because you're always going to need clothes. And you get a new job and you might need a new wardrobe. So it's definitely something you want to put in your budget. Fixed would probably be food. Variable would be Wi-Fi. And discretionary would be some sort of emergency, like my car breaks down or something. Okay. So Manuel, let's say your food is fixed, and today this hamburger cost you $1, but tomorrow it costs you $1.10, and next week it costs you $1.20. Will you not eat the hamburger because you only budgeted $1 for the food? Or would food be a variable expense? You know, I'm really asking you guys to think after a long, hard day. Yeah. Because food fluctuates, right? The price of food fluctuates in a manner which you have no control over. Now, I did budget, let's say I budget, my family food budget is $300 a month. And I have to spend that a little differently as food cost fluctuates. I'd have to decide to spend my money a little differently, but I decided that it would be $300 a month, which is unrealistic. Nobody feeds a family for $300 a month, but I hope you got my point with that. Okay. And my Wi-Fi bill is fixed because it never changes. It is what it is. Whatever it is, honestly, I don't know because I don't pay that bill. My husband does. But it's a fixed bill. I know that much. Okay. Anyway, Thank you guys for paying attention. I'm going to move on. Okay, fixed Spotify variable food discretionary crystals. Okay, pretty good. All right. All right. So once we know what the point of knowing what your expenses are is so that you can make a budget. Determining my income, what are my expenses? It's known as reconciling. So like I said, you will never have to worry about balancing a checkbook. You probably don't even know what I'm talking about. Anybody know what a checkbook is for real? Amanda, do you know what a checkbook is?
I know what a checkbook is, but I have never had to balance one.
You never will. It's just, life has just changed so much for you guys. So all good. But reconciling is known as this is what I have coming in, this is what I have going out, and what's left over. And you should never have more going out than you have coming in. If that's the case, you need to change the way you're living somewhere, somehow. But you should never have more going out than you have coming in. And you can control that. So you prioritize your expenses based on your goals and your needs, determine whether your budget will work. And if not, then you revisit it and you make your changes. We are going to look at this exercise is the same as, anybody got any questions about anything I've said so far? I feel like I'm going really quickly and yet my time is going by. Questions? No? All right. So this worksheet is pretty much the same as our time worksheet, right? We're deciding what our expenses are. Are they fixed, variable, or discretionary? What is the amount? Is the priority high, low, or medium to me, right? Because that's what really is a checkbook. Oh, Anaya. All right, I'm going to go get mine and show you. So a checkbook is, it's a, God, what is it? It's
It's a ledger. So
yes,
if you were writing
that's
a
the
check,
word, Kay. It's a ledger.
if you were out buying something with a check, you wrote in the checkbook how much the check was for and who you wrote it out to and the date that you wrote the check, because there was a delay between you giving the check to the person you're buying the service or good from and them cashing that check and then your bank putting that debit on your checking account. So the important thing was to keep track of how many checks you had out in the world, because you might overdraft by writing too many checks. By the balance is you add up all the checks that you've written and then you add up all the money that you've been getting in income for your account, and hopefully you're in the black once you've done that. But more often than the reason it's a difficult task is because it involves arithmetic and also involves the possibility of you having overdrafted your checking account. But now when we have bank transactions happening instantaneously with digital access to our bank accounts where you can see every transaction that's pending and posted, it's not a thing that you need to worry about keeping track of anymore. And also
Right.
very, very few people take personal written checks anymore.
That's true. Yeah, you should ask your parents too, because I know, like, I write a check for my homeowners association. That's probably the only check I write. Oh, and the dog groomer, because they're not on Venmo. That makes no sense to me. But she takes a check too. So yeah, Kay's right. It's a written piece of paper that we used to fill out. I, Rhonda, like, I'm going to pay Anaya $20 and write it out. And I give you this piece of paper and you take it to the bank. So that, yes. And you had to make sure you were spot on with how many checks were out. It was quite a juggling act sometimes. And now, though, everything is instantaneous, like Kay said. And so nobody hardly takes checks in anything, even the bill paying. So now it's all instantaneous online. So, okay. We're still talking about budgeting. So we have our expenses, our cell phone, going out with friends, movies, and savings. This is our budget is $200. That's our income. I did that. Okay. So we want to buy a new phone. It's $50. And This has to be updated. So let's say it's a new phone plan that's $50 a month. And so I can't go over $200. So I have to find somewhere to take out $50. So same thing with time. My question to you guys is, where would you take out $50 so that you can bring the 250 down to 200? And again, no wrong answers, but I do want to know what you guys are thinking. What would you do with that? Because you have to reconcile. Excuse me. You have to reconcile 250 down to 200. So you got to take your money from somewhere. Okay. Jordan would take it from the movies. Yep. Because we're all on Netflix now. That's smart. Mark would take it from going out with friends. Okay. There's, like I said, 12 of you at least. So I want to see some more answers. Where would you take away $50 so you can bring your 250 down to 200? Going out with friends. Okay. Oh yeah, you could definitely take a whole 50 out of going out with friends and take that down to 25. Okay. Okay, 25 going out and 25 of the movies and new cell phone. Okay. Yeah. So I like Adriana and Manuel said, you know, they would take a little bit out of two different categories. And I like that, right? We're not depriving ourselves of these things. We're just going to reduce a couple of them so that I can make room for something new. So I like those answers. Okay. Thank you guys. Appreciate that. Let's see. So in this instance example, we took out 25 from going out with friends and 25 from the movies. I'm glad you guys didn't take anything out of savings. I didn't see anybody take money out of their savings. So good job. All right. That budgeting our time and our money. Okay, so what type of expenses do you have the most control over? Your fixed expenses, variable expenses, or discretionary? What do you think? That's for you guys to answer. Which type of expense do you have the most control over? So a fixed expense is something that never changes, right? My rent or my mortgage or my car payment. A variable expense is something that does fluctuate with usage and the market, right? Gas for my car, food. And discretionary is if an emergency happens. So which one of these do I have the most control over? Okay. So Adriana said discretionary. Sometimes, right? If I need a new tire, I don't have much to say about that, right? But my savings I do have control over how much I'm saving for that. So, okay. Anyone else? No wrong answers. You're just thinking, you're trying to get your aha moment going on. What do you have the most control over? Jordan, me. Okay. That'll work. All right. All right. So some things for you guys to think about. How does prioritizing affect how we budget our money? Because when I know what's important to me, like I said about my hair, that was important, and I wasn't giving up on that in my budget. So it was important to me. Manuel said using savings. Yeah. Okay. So prioritizing affects our budget and our money. What might happen if we don't use a budget? And I think you guys, some of you answered this question earlier. Your money will run away. Money has wings and it flies away. And sometimes you really are like, wow, what happened to my money? It happens, right? I think somebody said earlier too that we sometimes it's spent before I can make it, and it does happen. So sometimes though, if we prioritize and we know what's important, we can, be smart with our money. So why is savings an important part of a budget? Now you guys tell me, why is savings an important part of the budget? I'm really tired of hearing myself talk. Why is savings an important part of a budget? Have money ready for the future. Yep. To be prepared for unexpected emergencies. Yeah. Yep. Oh, that's really good, Adriana. If you want to make a big purchase, you can avoid getting a loan. I like that a lot. Okay. All right. So unexpected expenses. How do people deal with them? That's what the little chart says. So 37% of people use their savings. 23% reduce spending on other things. 15% people use a credit card for unexpected expenses, which makes your unexpected expense more expensive because you're going to be paying interest on that credit card. And 15% borrow from friends and family. And if you have those friends and family, I'd like to know. Mm-hmm. Although when my children were growing up, we have a joke in my house about our Excel spreadsheet, because if they borrowed money from me, I used to fill out an Excel spreadsheet, and I'd give it to them. And then as they paid me, it would go on the spreadsheet, and I'd say, everybody's on or off the spreadsheet this month. Because things do happen. And as young adults, if I could help, I did. But I expected to be paid back. So, okay. So some things that can hinder managing our time and money is procrastinating, putting off things for too long, keeps me from accomplishing my task and doing it well. Impulsivity, spur of the moment action without thinking of my results, and cultural considerations, right? How are time and money thought about in your culture, in your experience, in your family? Do you have anyone in your family who has taught you about budgeting? Do you see that in your family? All of these things impact our time and our money, right? And I think you guys can see how all of this is important and impacts our time and our money, because I can procrastinate away my money, my time, and my money, actually, because if I put off paying a bill, because I just put it off for whatever reason, then I gotta pay fees. I hate fees. I hate giving people my money that I worked hard for, that, because of my stupidity, or I forgot something, or I put it off. Impulsivity. So that could be for my money, when I get distracted by shiny things at the store, and then I buy something I didn't go there for. Impulse buy. That's what, like, the checkout lanes at grocery stores, all of that is about impulse buy. And they're trying to get you to spend more money than you went in there planning to spend. So culturally as well. So what are you hearing about money? Have you ever talked to your parents about money? Can I get a yes or a no in the chat box, please? Do they talk to you about money? Okay, good. Yep, good. Mark, capital letters all the time. That would be my husband too, with my kids. But yeah, good. I'm glad. Yeah. Very good. When I was growing up, my mother would be your grandmother's age or so. She thought if she had department store credit cards, that that was a big deal to her, and that she could buy things on credit. And so, but now, like, I don't buy anything on credit because I don't want to give people my hard-earned money is with the interest rates. So it's just interesting how things do change as time goes on. And the more we talk about it and learn, the better we can do, right? Oprah says, when you know better, you do better. All right. I am almost done. Skills to, I got 3 minutes, Kay. I'm going to get there. Skills that help you handle procrastination and impulsivity. So keeping your goals in mind, managing your stress level. So we're not out there with retail therapy, which we shop to make ourselves feel better or eat to make ourselves feel better. So that would be managing your stress level, keeping it at, place where you're making good decisions, thinking with a level head, and use your decision-making skills. Okay. I think, anybody got questions, comments? Teach me anything. See, I'm done. Thank you all for being here again tonight. And, hope you go forth and budget your time and money well. As Kay comes back to say goodbye, I'm going to leave our resource page up here for a little bit. Before I go, if you have any questions, don't forget about the job fair Saturday, my email, or if you have any questions about that, Kay. If I could change anything about the money system, what would it be? That was a big question mark. I was thinking, as I was talking to you guys in your age, I was thinking about college and loans and the repayment plan on loans. And if I could change our money system, I would like to do something about that. I don't think an education should be that expensive for young adults. It's astronomically out of control. So that's what I would change about our money system overall, if that answers your question. Thank you. I don't know what else might change. What about you, Kay? Maybe I might go back to the check system because I can pay for something on Wednesday and it won't come out till next week.
I mean, mine is fairly esoteric, but there's a federal law that requires banks to transfer funds before they are able to verify whether those funds are actually available. And that's how a lot of these, there are various online check cashing scams that are, people write a bogus check and they hire you and they send you the check as your wages. And they say, oh, the check's bigger than I owe you. So cash the check, keep some of it for yourself for payment for this bogus job, and then send me back some of it. So what you're actually doing on their behalf is cashing a bogus check and taking overdraft fees from your bank that they get money for, and then you get stuck with the overdraft and the fraudulent charge. So the reason that the law requires banks to make those funds available is so that people, as we were talking about it being more instantaneous these days, it takes time on the back end for the bank to balance between the transfers and the debits, but they make those funds available instantaneously so people can still use them. But if the check is faulty, it takes a couple of weeks to untangle that. So you might not even realize you've been scammed until several weeks later. So that's a particular scam that I think is especially pernicious because it preys on desperate people who really want work and are trying to do the right thing. So if there was a regulatory or legislative fix for that, that would be the thing I would change.
I didn't know that existed. Don't give your hard-earned money away.
Don't ever cash a check for somebody else.
Right. And don't pay bank fees. Man, I told you, you work hard for your money. Stay out of the fees. Yeah, exactly, Mark. I like my money too. Trust me. All right. Thank you guys. Kay, thank you for having us. We'll see you guys next week.
Thanks, Rhonda. Thanks, Amanda.
Thank you.
I'm going to stop share.
All right, everybody, we are at 6:55. We are going to take a brief recess and we are going to reconvene at 7 for the presentation with Mr. Rush on healthcare careers. And in the meantime, feel free to get up, stretch, do whatever, and we will reconvene at 7. I will give everyone a 1-minute warning before we get started. And thank you again for asking questions and answering things in the chat. We really appreciate when you guys participate. We think that makes it better for everybody. So yes, 5 minutes and we will reconvene for healthcare careers. Thanks, everyone. All right, everyone, this is your 1-minute warning. We'll be starting again at 7 p.m. with the presentation on healthcare careers. Mr. Rush, can you hear me?
Yes, ma'am. Can you hear me okay?
Yes, I can. Thank you. I appreciate you joining us.
We've got Darian Smith on the line as well.
Yes, he joined it earlier. We were chatting before the presentation began. So I've set it so that panelists can share your screen. So I was going to have you guys do the presentation and I will help monitor the chat for questions and responses. And we can get started at 7.
Okay, I may need a second then. I'm trying to email myself the presentation from my work email to my personal computer because my work one isn't working with the Zoom stuff.
I can.
So I may need you to pull it up if that's okay.
Yeah, I can pull it up if we need to. Hang on.
Got it up, Rush?
Oh, you do? If you have it up, that's fine too then.
Yeah, I got it up.
Okay, great. Thank you. All right, it is 7 p.m. So I'm going to turn it over to our presenters for the STEM portion of the evening to talk about healthcare careers. Just let me know if you need me to bring up the presentation or if you're.
Okay.
All right. And as always, if you want to ask a question, type it in the chat or raise your hand and our presenters will respond.
Yeah, perfect. Well, good evening, everyone. I'm Lieutenant Commander Stephen Rush. I'm in the United States Public Health Service, and we're going to give you guys a presentation today about various career paths in the Commission Corps. But we're also going to be available to answer a lot of questions as it pertains to just healthcare careers in general. Lieutenant Darian Smith and myself, even though he's a dental hygienist and I'm a pharmacist by nature, we both have a pretty wide knowledge of different career paths that you can take, especially as they pertain to the government and things of that sort. And we're going to share a lot of information as well as it pertains to the U.S. Public Health Service. So there, I'll let Lieutenant Smith also introduce himself, and you'll hear my voice again here pretty soon. Go ahead, sir.
All right, how's everybody doing? Lieutenant Commander Rush said I am Lieutenant Darian Smith, and I'm a dental hygienist in the United States Public Health Service, and going on about 6 years now. So I really enjoy it. It's a career path that when I was sitting in your shoes, I didn't know existed. I wish there was a platform like this, a forum like this that the Commission Corps could have utilized or that I would have known about. So I think you guys are in a great position. We got a good treat for you here today. So a lot of content, but we've got it kind of formatted a particular way. So we're going to try to go through it, and we want your feedback. So, if you all have questions, you can put them in the chat. As we go through the presentation, we will definitely slow down and we'll answer questions. We got different points in the presentation where we can do that. So without further ado, we can go ahead and get started. You ready to roll, Rush?
Yes, sir. Let's do it.
All right.
And I'm not seeing the presentation on my end.
It's not showing. Uh-oh. Okay, are you able to see it?
No, we see your Zoom dashboard.
Oh, I'm sorry. Let's do this. Sorry about the technical difficulty there, y'all. Give me just a second.
No problem. Yeah, while he's working that out, I just wanted to reemphasize, you guys, we're going to give you a lot of information, and we're going to pause throughout the presentation and give you chances to ask questions. Again, you can put them in the chat, and we'll try to get to them as we can as well. And Lieutenant Smith is going to kick us off, and then again, you'll hear my voice again here pretty soon. Looks like I just saw it and it went away again.
Did it pop up? All right, hold on. Let's try it one more time. And we'll go here. And boom.
We can see it now.
All right. Still up?
Yep.
All right. Here we go. So United States Public Health Service, that's what we're in. That's the branch of service that we are in. You see in the uniforms, we kind of wear the blue there. So what it's officially called is United States Public Health Service Commission Corps. You know, we have mottos, we have mission statements and different things like that. We were established in 1889. So we've been around for a very, very long time. When you think about the other different branches that are out there, the Army, the Navy, the Air Force, Marine, Coast Guard, we all know about those branches. And when we call them out by name, typically we know them as the armed forces. But there are two other branches that you may not hear much about. One of them is NOAA, right? They do a lot of the hurricane hunting and flying into different hurricanes and getting us, national weather and different things like that. And then you have us, United States Public Health Service. So we are under the leadership of the Surgeon General. And, there's a multitude of us, that kind of serve both nationally and internationally with the mission to protect, promote, and advance the health and safety of the nation. So I'm one of these people who believes in, in order to know where you're going, you kind of have to know where you come from. So I'm not going to give you all, a super in-depth history lesson, at 7:05 Eastern time. But, I'll just give you a quick background. Back in the day, like years ago, one of the main ways of transportation and the way commerce used to work, things would get moved from, location to location internationally and things like that by boat. And one of the challenges were, the merchant marines and the different sailors and seamen. I mean, they were human, they got sick. And so you're traveling international from one place to the next place and people are getting sick. So you bring in an illness from one location to the next location. And obviously this presented a problem because ultimately at the end of the day, a lot of things, as you heard in the previous presentation, a lot of things is about money and how to manage it. And so when you start messing with money, there's an issue. So, and then people are dying and these kinds of things. So that's kind of how PHS got started in 1798, the Act for the Relief of Sick and Disabled Seamen. So there was actually an act that was created. And then there was you'll see a fund essentially that was designed or developed that would kind of pay for the services of treating, the different sailors and seamen who, would go forth and get sick. And ultimately the success from that kind of grew. It was working, right? We're not slowing down commerce and people are ultimately getting treated and getting well and so on and so forth, that it led to what is known now as the Commission Corps. So you initially had the Marine Hospital Service, you had the Commission Corps, and ultimately now you have the United States Public Health Service. And where we serve as officers are Commission Corps. So essentially the title is United States Public Health Service Commission Corps. We are a component of that. And things just kind of progress from there. You can see some of the different history there. The broadening of powers, the establishment of the Indian Health Service. So when you think about all of the different healthcare agencies, the FDA and the CDC, all of the Indian Health Service, many of you may be familiar with that, you may not. All of these different agencies that are related towards healthcare fall under the umbrella of, the United States Public Health Service, and we are the Commission Corps component of that. So as I mentioned, that's kind of who we are. Again, one of the 8 uniformed service branches, and at this particular time, I think, we're about 6,000 plus strong. And we're the only branch that's dedicated solely to protecting America's public health. If anybody knows, especially now, everybody is aware of, you hear the term public health, right? We're not talking about just the one individual or the people that are just in that one section. We're talking about, a large group of people, or it can even be isolated. But when we're talking about public, meaning more than one, that's what our sole mission is about, is protecting America's public health. As I mentioned, we do have a mission statement to protect, promote, and advance the health and safety of the nation. At our core, that's what we are established for. We have day-to-day jobs, and we have some deployment opportunities as well. We'll get into that a little bit later on. But these are the things that drive us. Our mission statement and also our core values: leadership, integrity, service, excellence. All of these things you can find within a Commissioned Corps officer or United States Public Health Service Commissioned Corps officer. One of my favorites is integrity, right? It's the ability, right, to do the right thing when no one's looking, right? Being ethical and accountable and responsible. Kind of following on the heels of the previous presentation when we talked about, when Rhonda mentioned about being disciplined, right, and balancing the budget and doing all these different things. All of those are some core characteristics that will make up a Commissioned Corps officer. But these are just the main core values that we live by and stand on, that and we kind of carry ourselves by. So just like in many of the other branches, there's policy, right? There's different things you have to do. A commission is not just handed out. You have to qualify for it, right? You got to be a U.S. citizen, less than 44 years of age. If you are, if maybe you all don't want to join the public health service when you graduate high school and you end up going to college, maybe you don't want to join right then. Maybe you end up joining one of the other branches. Well, you can still end up joining the public health service after the fact. You just got to make sure you have less than 8 years. So you got to pass a physical examination, security background check, all of these things. Every Commissioned Corps officer that you would come across, myself, Lieutenant Commander Rush, all had to go through, a clearing process or a vetting process, if you will, to ensure, that we were ultimately fit for duty. Okay. So, and these are just a few of them. There's quite a few more, but these are some of the main ones. Even a professional interview, they call that boarding. You actually have to, sit before a panel. These days it's virtual. Before, I think it was just on the phone, but you can get a phone interview, a virtual interview, but ultimately you sit before a panel and they ask you different things about, what makes you want to wear and serve your country in uniform. And they speak to your character, name a time when you have gone through a challenging circumstance and how did you overcome it, all these different kinds of things. So you definitely have to qualify for it. They're not handed out. And they definitely want the best of the best at a high level. So this actually has just changed recently. So they're sorting through a lot of the policy, but the categories still kind of still hold true at their foundation. So in order to be in the public health service, you have to, you have to have a degree of some sort, a minimum of a bachelor's. And so that's what makes us unique to a certain extent, because in many of the other branches, you can come in enlisted. We don't have any enlisted personnel. Everybody is an officer. And depending on what your education path is, whether it's a physician, you'd be in the medical category, with an MD degree, or a dentist, you'd be in the dentist category. Veterinarians, nurses, pharmacists, dietitians, we all have 11 categories. And depending on your category, you would be, or your profession, you would be in one of these categories. Now, it kind of goes a little bit in depth, and I'm not going to go too far in it, but there are some that have some sub-levels to them, like therapists or even health services. So myself, for example, I'm a dental hygienist. The dental hygienist falls in the health services category, just like a physician assistant. They would be considered a health services officer. And then same thing with therapists. There are different kinds of therapists: respiratory therapists, occupational therapists, speech therapists. They all kind of fall in the same category. So, there's some sub levels to some of these, but for the most part, this is one you would come in as one of these particular categories.
I wanted to mention your slides are not advancing on the screen.
Okay, let's go in here and do this. Which slide are you able to see at this time?
It still says the U.S. Public Health Service and Commissioned Corps intro.
Okay.
Yeah, it's showing slide 2. Darren.
Okay.
Yeah, go up to the left and where it says from beginning, click that. Over to the left, click that. And then advance.
Okay.
It's
Yeah, it's
not
not-
moving.
Yes. It's moving on my end, but I guess it's not moving on you guys' end there.
Do you want me to share?
Okay,
the
yeah. If you
presentation
want to
screen?
jump in and grab the slides there. I'm not sure what. Sorry about the technical difficulty there, you all.
Thank you all for bearing with us while we get
Yeah,
this sorted. Can you see my screen now, everybody?
Yeah, see it up.
Okay. So I'm going to advance to.
And again, everyone is getting a copy of the presentation too, right?
Yeah, all of these slides will be available on the program website for download after this presentation. So you guys can all access this information from the website as well.
Okay.
But just let me know when you want me to advance the slides and I will shift them forward for you.
Okay.
Perfect. Okay.
Cool. So yeah, like I mentioned, every officer, every PHS officer has some sort of a degree, whether it be a bachelor's or master's or, a doctorate level degree, just kind of depending on your training and your education level, you would, be commissioned in one of these particular categories. So we can go ahead and advance the slide, and actually we'll segue over and I'll transition to Lieutenant Commander Rush, and we've talked about, what a commissioned corps officer is and kind of what we do. And he's going to segue over into talking to more about where we serve at. Lieutenant Commander Rush, floor is yours.
Yeah, thank you, sir. Great job on that history lesson as well. I never get tired of hearing about it because we are so unique and a lot of people just don't know who we are. I know my elevator speech, as we call it in PHS, is always what most people have heard of the Surgeon General of the United States. And they know he wears a uniform, but they just don't know what branch of service he's in. And this our branch. And so that's a quick way that I like to sum it up as well. And we tackle a lot of, and I'll get into some of the deployment missions, which is what makes us actually active duty. I do want to pause for a second and just talk about some of the places we work. Because what's unique about the Commissioned Corps is that even though we are a uniformed service, it's set up and we're considered active duty, the setup of it is actually kind of like a reserve situation. And the reason I say that is because most officers, we work at any federal agency. And then whenever there are emergencies throughout the country, that's when we'll get deployed to support missions. But what's unique about us versus like Navy, Army, Marines, Air Force, Coast Guard, things of that sort, is when we do get deployed, and I'll touch on this again a little bit later, our missions aren't for the 18 months or the 24 months. Some of you may have family members that had to go to Afghanistan back in the day for like 2 years at a time or for a year and a half. What's unique about us is when we do go out the door, as we call it sometimes, is we're only gone for 15 days to a month. Sometimes it can get extended up to 2 months or so, but it's really not too bad. And so in the meantime, you'll work a job similar that is public health related. It can be clinical in nature, it can be administrative in nature, somewhere in between even. And as Lieutenant Smith said, we have currently right now around about 6,000 officers. I think we're just under 6,000. We're in all 50 states. We've got a couple even in foreign countries, depending on where you work at. And there's over 800 locations nationwide. And so a lot of these places fall under the Department of Health and Human Services. That's where we're based out of. So another thing that's unique is, most people have heard of the Department of Defense, and that's where Army, Navy, Marines, Air Force, things of that sort, that's where they're all detailed to. But HHS is where public health service officers are located at. And so a lot of the HHS agencies, as you'll hear me refer to throughout the presentation, and I've got a lot of slides at the end that I'm going to leave you guys. I'm not going to go through them all, but I left you guys some more information on these agencies at the end of the slide so you can get a better understanding for what goes on at each particular one. Some of the more common agencies that we work at are CDC, which is where Lieutenant Smith is. That Centers for Disease Control and Prevention. Most people have heard of CDC, especially with all the stuff that's been going on lately about COVID. And so that's a popular one. Also, the Food and Drug Administration one is a very popular one. Some people haven't heard of what we call HRSA, as you see on the screen, HRSA. That stands for Health Resources and Services Administration. But there's a lot of work that goes on there. CMS, most people have heard of Medicaid and Medicare, but CMS is Centers for Medicare and Medicaid Services. So that's where that agency is based out of and things of that sort. You have IHS, Indian Health Service. You have NIH, National Institutes of Health, SAMHSA, Substance Abuse and Mental Health Services Administration. So you've got a lot of places within HHS that we work regular day jobs. And we'll go into our career paths and help you understand this stuff better as we go throughout the presentation. But I just want to give you guys a feel for some of the places that we work. Again, Department of Defense, which is where I'm located currently. We have Homeland Security, and that's where the U.S. Coast Guard is housed, as well as ICE Health Service Corps, which is a place that we work. And we're going to touch on that again, as well as the Federal Bureau of Prisons. And then you've got various state and local government agencies as well, where we can participate and help out. Next slide, please. And so this is what we essentially do. And I kind of touched on it on the last slide. We provide essential health services. A lot of these are in clinical and vulnerable populations. So when you hear me say vulnerable populations, what that means in terms of PHS and where we work is we have a lot of officers that work for the Bureau of Prisons. So anyone that's in the federal penitentiary, regardless of why they're in jail, that's one separately, that's more of a justice system issue. But while they're in custody, they get healthcare. And so a lot of times folks don't want to work in these particular environments. And so that's where we come in and we help the underserved population. So you'll hear people talk about Indian Health Service from time to time. That's another location where we work at a lot because there are a lot of remote locations where these Indian reservations are located for Native Americans. And so to help fill these tribal hospitals and local hospitals in those areas, we have a lot of PHS officers that work there. And the same for ICE. Again, you have ICE, which handles the legal side, and then you have ICE Health Service Corps, or IHSC. I know I'm giving you guys a lot of acronyms, but those are some of the other places as well where we provide some of these essential health services. We serve on the front line when it comes to public health emergencies. Again, you heard me mention COVID. I think not too long ago, some of you may remember Zika virus, even Ebola when we had the scare in Africa. And I think a couple of people even brought it back to the United States. Those are some of the reasons why we get deployed as PHS officers. And so that's what's unique about it. And you get to see a whole new perspective on what takes place, how FEMA works, how a lot of these organizations work to handle emergency management for the country. And it's actually pretty smooth to see and pretty cool to see. I actually was deployed, and again, I'll touch on a little bit more in detail later. I got deployed for COVID twice. So I went out to Seattle when COVID first got to the country to help with the nursing home, as well as some of the airport missions that we had with doing various screenings. I also had to go to St. Louis, Missouri to man a mass vaccination site. So you get a lot of cool stuff like that you wouldn't typically get to do just working a regular day job, which is what makes U.S. Public Health Service interesting. You also lead a lot of the public health programs and policy development. So anything that's related to healthcare, clinical guidelines that several doctors follow, a lot of the times it stems from the work that we do. And so we have our hands in a lot of pots. And also advanced innovation in science. We're always looking for ways to be more efficient and to do things better. And a lot of times, we're at the forefront when it comes to that. But again, we're so behind the scenes that most people haven't heard of us, but it's a lot of great opportunities here. Next slide, please. And this slide talks about the Ready Reserve. Again, we are an active duty component, and this is something that actually was just implemented a couple of years ago, almost 2 years to the date. March 27th, 2020. It's still being implemented with the Ready Reserve Corps, and it'll be set up kind of like what you hear with Army Reserve, Air Force Reserve, and things of that sort. And that, you have folks that until they're called upon, they just work regular jobs, which almost sounds similar to us, like I mentioned with the way that we are organized so far. But in actuality, these folks would actually be called up, whereas us, we can get the call and we can be out the door within 12 to 72 hours, just depending on what your role is on the team. And so that's what's unique about the Ready Reserve. That CARES Act that came out not too long ago during COVID, the Coronavirus Aid Relief Economic Security Act, is where the PPP loan came from. A lot of that stuff, it's all looped into this one act. And the Ready Reserve was a part of that as well. And so what the plan is for the Ready Reserve, as you see on the slides here, it's going to support a lot of what we do in the Commission Corps, the capacity to respond to regional, national, and global health emergencies and improve access to health services. So what that means is when someone like us gets sent out the door, sometimes these reserve folks may go out the door as well, or sometimes they may backfill the position that we're doing on a regular day-to-day basis. It just depends on what's needed. So we can help with some of the clinical care positions, as well as various mission-driven specific needs that may be out there throughout the country. And so it'll enable access to a lot of highly specialized skill sets As you heard Lieutenant Smith mention the various categories that we have. I mean, we've got 11 categories, and 2 of those categories can be broken down into even more categories, especially when you start looking at therapists and health service officers as well. And so we've got a lot of things that we can do that we're capable of. It's a lot of talent and a lot of skill within the Commission Corps. Next slide, please. And readiness and deployment. So this is what I kind of touched on. Readiness, Lieutenant Smith touched on earlier, especially when he was talking about some of the fitness aspects, what it means to come into the Corps. So we don't have a quote unquote boot camp like what you hear about that so many people dread. We do have a fitness test that we have to do every year. This fitness test basically consists of 4 items. One is, can you touch your toes? And it's just a yes or no question. So that's the easy one to get out of the way. Then you've got a 2-minute test where you do how many push-ups you can do in 2 minutes. And based on what age range you are, if you're male or female, the minimum amount, they do have that there as well. There's also a core endurance or your ab strength, just to be transparent about it. So you can do the sit-up test in 2 minutes. Some people prefer to do the plank. Some people prefer to do the side plank. And again, based on your age and your gender, there are different time frames for the minimum as well as for the maximum. And then last but not least is the 1.5 mile run. But typically with the 1.5 mile run, again, the times are based on what your age and gender are. I'll keep re-emphasizing that. But after you do that test the first time, you can substitute it with the bike. Some people do the elliptical. Some people like to swim. So there are other ways to test that endurance, but that's the part of being basic ready. So whenever you're going to be deployed, a lot of times, if you're not basic ready, then you won't be ready to meet whatever mission. It's not like when you go out of the door, a lot of times you're going to be in comfortable settings. A lot of times you will, but at the same time, you have to be in decent shape. You want to look good in uniform and be respectful of other uniform services and things of that sort. So that's why we have those things in place. And what is my screen doing? Also, as far as deployments, let me go here. We have various missions. Again, the domestic and international operations. I touched on some of the international operations earlier when I talked about COVID and Zika virus and things of that sort. But domestically, another thing we often support is when you hear about hurricanes. Katrina is always one that comes to mind. Maria and Irma come to mind. Whenever people get displaced like that, we get sent there to help get them squared away so they have access to healthcare. And so that's another reason why we'll be there. That's where you see disaster relief and emergency response. And we have various trainings that we do throughout our careers globally that we, just to keep up and keep our skills sharp and understand the different needs culturally. I heard on the previous presentation when she was talking about money management and things of that sort, different cultures, there are different things that you want to make sure you pay attention to and be respectful of when you're going to some of these international missions and things of that sort. So it's always good to understand different folks' customs and courtesies and how to be respectful. Next slide, please. And so what's also unique and one of my favorite things, and Lieutenant Smith likes to talk about these as well, are the benefits. That's what you really get into when you start talking about PHS and that active duty aspect. Because again, what's unique about us is that we are active duty, so we get a lot of the active duty benefits. But because when you're not deployed, you're working a regular job. It's almost like having regular benefits of the private sector as well. And so that's what makes it really, really unique. We talked a lot about money again, and this is a perfect segue into that. And so you talk about low-cost medical and dental and vision care for officers and their dependents. So just so you know, when you're active duty, your healthcare is free. I recently had a foot surgery that probably would have cost me $20K or so on the private sector, but because I'm active duty, it was on the house. And so that's nice. And it's a lot of money saved. And money saved oftentimes is just as good as money made. As you'll hear saying, you get a real nice retirement plan. So I'm on the we have 2 different retirement plans on the Corps, depending on when you came in. So I'm on the plan where if I retire after 20 years, I'll get 50% of my highest paid pay in a pension until I die. If I work 30 years, then I'll get 75% of that until I die. Whatever my highest amount of money made is during my career is what I'll get in a pension. And so, if I wanted to go work a second job, because I'll still be pretty young when I do retire, then I can double dip and get my retirement paid and then get paid based on whatever that job is. So that's why stuff like that can be significant and it's different benefits. Again, I don't know if you heard me say that, but after 20 years, you can shut it down. And what's unique is you heard me mention about the different places of where we work, the different agencies. You can change jobs within agencies. Like right now, I'm on my third agency right now. since I've been in the commission corps. And every time I change jobs, I don't lose that time, which is different from the private sector. So if you leave one job and go to another, unless you stay within the same company, oftentimes you have to start all the way over. Sometimes there are ways that you can transfer your 401k over and things of that sort. But what's nice about it is that you don't lose any of that time, and you can get a wide range of experience, which Lieutenant Smith and I will touch on as we share our different career paths and our own career testimonies. But that's another thing that's unique about it. You also get the post 9/11 GI Bill, which is an education benefit, and you can use that yourself or you can pass it on to your kids. So what that means is it's 36 months of free education. So who wouldn't want to take advantage of that? We all know that student loans are ridiculous right now. You know, if we're just being honest, and if you want to go to grad school and things of that sort, these are things that you can use. You can pass this on to your spouse or you can pass it on to your kids. And so that's another thing that's nice about the Commission Corps. You got a lot of diverse career opportunities and professional growth. You've heard me speak about the training. You've heard me speak about the different agencies that will work, and we'll put it in more perspective as we continue on throughout the presentation. And again, feel free to put questions in that chat box. We're going to pause here in a little bit to answer some questions because we know we're giving you a lot of information, but we want to just be as thorough as possible, but also cater to what it is that you guys need with the information, because we can talk about this stuff all day and all night. And then also you have that potential ability to transfer from a civil service or another uniform service. You heard Lieutenant Smith touch on how we have inter-service transfers. So what that means is if you were in the Army, if you're in the Navy, if you're in, the Marine Corps, anything like that, and you want to transfer over and not lose that time, then you can do so. Additionally, you can also transfer your civil service. So let's say you're a GS employee, which is what a lot of government employees are paid on, is the GS scale. And you come into the Commission Corps, well, they'll count that GS time that you used up before with your current active duty time, which will go towards your retirement. So hopefully that makes some sense. And then you also have the opportunity to be involved and help a lot of people in need, especially when disasters occur. And that's also what's unique about it. So again, I won't go through the basic requirements again. Lieutenant Smith already touched on that. We do have various height and weight standards. Again, you are in uniform, you want to be respectful. Typically, as long as your BMI is less than 27.5, you'll be fine. That's the quick way to put it. And then you also have to be medically qualified. If you click on that link, whenever you guys are going through the presentations yourself, Lieutenant Smith does a good job of explaining this as well. But you can click on that medically qualified list and just see if you have any healthcare conditions that are on that list that would prevent you from being in the Commission Corps. So that's something to pay attention to. And so it's pretty cool because you get a way to serve your country, but also kind of keep your private sector life as well. Next slide, please. And again, I talked about the career diversity. I talked about the professional development. When I joined into the presentation, the person who was presenting talked a lot about work-life balance. That's another thing that's big. And as young people, again, I'm young as well. I feel like I'm somewhere in the middle, but I definitely feel like I'm still young. But I don't think we often pay attention enough to what benefits really mean and what they stand for. That's the reason I'm trying to explain it to you the best that I can. So when we say you get 30 days of paid leave per year, that's 30 days. Like that's a whole month off that you can get, right? You can also transfer 30 days over. And so you can't go into any year with more than 60 days of leave. Right now, I'm sitting on about 70 or 80 days of leave that I need to use up, but I can't transfer over more than 60. So I'm getting to a point where I have to use that time. And there's another slide that's going to touch a little bit more on the specific. Leave is another way of saying time off or paid time off as well, for those of you who don't know. On the government side, we call it leave. You also have financial advantages. So you have non-taxable housing as well as subsistence housing allowance with the possibility of special pay. So I'll break that down. So non-taxable housing, when you're at active duty, for one, you get your regular base salary, right? And that's based on whatever your rank is. Like I'm lieutenant commander, Lieutenant Smith is a lieutenant. We have commanders, we have captains, we've got admirals, we've got Lieutenant JG. So based on where you fall on that scale is what your base pay will be. And that's the pay that's taxable. But what's unique about that is that it'll look like on paper you make less money than you actually do. But then we also have additional ways for you to get paid where it's non-tax. So one of those ways is every month based on the zip code of where you live, you'll get your BAH or basic allowance, basic assistance for housing, I think it's called. Basic allowance for housing, I'm sorry. And that money's tax-free. So being in the DMV area with my rank, and this is all public information, I get about $3 grand a month just to live off of, just to pay my mortgage off of, and it's non-taxable. Also, because I'm a pharmacist, I get a specialty pay. So that specialty pay is another, X amount of money every month that's non-tax. If I get a board certified, that's another bit of money that I would get that's non-tax. We also get about $250, $260 a month just to buy groceries. And again, that's non-tax. So even though you have your base salary, which could be, you know, whatever it is based on your rank and the time that you've been in, you also can get paid based on these things that I'm mentioning to you right now. So that's what's unique about it. And when you talk about being active duty, I talked about some of the health benefits already. Instead of the 401k style retirement plan, we have the pension piece, but we also have, which I failed to mention, a TSP or thrift savings plan. So that's the government's version of a 401k. So not only will you get a pension, but if you add to your TSP every month over the course of, you know, the 20 years, you'll have a nice pot sitting in there. And so once you retire, you also have access to that as well. And we talked about the life insurance and the survivor benefit. So if you're married, they have a survivor's benefit where they'll get, I think it's 50% of your pension. If something were to happen to one of us. And again, with the life insurance part, we automatically get $400,000 towards our life insurance policy if something were to happen to us. So again, I hate to be too detailed on it, but I want to make sure you guys are understanding what benefits are at an early age, because no one told me this when I was 18, 19, 20 years old. And so that's why I want to make sure I'm trying to explain it to the best I can, but keeping it simple. So if you have questions on this later, we'll touch on it as well. Next slide, please. And other benefits include college loan repayment. So there are two things here. Some agencies, especially if you work for the Indian Health Service, I think BOP does it as well, and certain parts of ICE Health Service Corps does it, is you can get your loans repaid. They may not pay it in full, but they'll pay up to a certain amount. So on this particular slide, it talks about how they'll pay up to 40 grand in your student loans for healthcare professionals, and all they want you to do is give them 2 years of service. That's worth $40,000 in my opinion, but you have to make the decision for yourself. So for me as a pharmacist, another thing that's unique is even though they don't pay my loans directly, I'm in what's called the public service loan forgiveness plan. So what that means is all I have to pay is the minimum amount on my loans every month. And after 10 years, my loans are forgiven. And so that's another benefit of being in the Corps. So being a pharmacist, I can tell you now, my loans were well over $200,000 for pharmacy school, but I'm probably only going to end up paying back about 30 or 40 grand before they get forgiven. Because again, as long as you're making your payments every month and you don't default on any, you can pay the bare minimum. Does that make sense? So I just wanted to share that as well. Next slide, please. And here we touched on already as well. We talk about career advancement and pay increase with years of service. Again, we get paid based off of our rank as well as the time in service. And again, this is all public information if you guys ever want to take a look at it. We talked about the healthcare costs and how that's free. The dental care, as long as you're getting your routine cleanings, those are free. But when you have to get certain additional services, sometimes they can come with a cost, just depending on who you go to, because different dentists build things differently. But that's a whole nother conversation. And again, the mobility between government agencies, which we'll touch on here, because Lieutenant Smith and I have had our share of agencies. I think you get ready to hear about just 5 different agencies between the two of us that you can get direct experience with that we worked at, both HHS, like I mentioned earlier, and non-HHS. So you'll get a broad perspective there. But again, it just adds on to your skill set, and you get to do things that you wouldn't typically get to do as a regular pharmacist, as a regular dental hygienist, as a nurse, as a physician, and things of that sort. But again, we're going to touch on some of those things. Next slide, please. And this one, I talked about the housing and meal allowance already, so I won't beat you to death there because I want to make sure we give you guys time to ask questions. Next slide, we talked about the benefits. Next slide, please. Yes, we covered all of this already because of me and my loud mouth. And again, I can keep talking about this stuff all day and all night. And last but not least, on slide 19, if you will, okay, my screen froze, I think, so I'm not able to see much. But slide 19, it starts with get 30 days paid leave a year. On that second bullet, I want you guys to pay attention to, especially all my gentlemen that are out here, where you can enjoy paid sick leave, maternity leave, and federal holidays. So we get every federal holiday. Obviously, our sick leave is unlimited, and to an extent. There are certain policies where if you're sick for a certain amount of time that you gotta explain what's going on. But for the most part, our sick leave is unlimited. But what else is unique and it's not on this slide is that you also get paternity leave. And I don't know about you, gentlemen, but it ain't too many jobs out there where once your wife has a baby or once who you're dealing with has a baby, that you get paternity leave, and it's extensive. It's not just a couple of days. You get a few weeks off, and so that way you can get some bonding in with your newborn and things of that sort. And that's just an added benefit. Another thing that I like is you get to enjoy, again, by being active duty, the services, lodging, vacation, and travel discounts. And so I got a couple credit cards where they're pretty high dollar credit cards, and I don't have to pay the annual fee because I'm active duty. And that helps tremendously when I'm doing my travel. And I don't know about you guys, but I love to travel. And so whenever you go stay at hotels, they usually have a military rate, which is significantly lower than what it would be in the private sector. Same when you're taking vacations and other travel discounts, you get military discounts anytime you want to go eat somewhere, just about. So it's a lot of little things like that that you get as well. Also, you get to serve your nation proudly by helping respond to a lot of these emergencies. And it just the fulfillment you get. And I'll touch on this when I share a little bit more of my career testimony. But again, you heard me mention when I was deployed, and the ability to help folks that are truly in need when you meet them. It's a special feeling. It's hard to explain, but it's really a special feeling. And it makes you proud to wear the uniform and things of that sort. Also, being that you are a medical professional, you have no cost professional liability coverage. So basically that's malpractice. That's another way of saying malpractice. So you get malpractice on the house, if you will, because you work for the federal government and because you're all trying to, protect the public. As Lieutenant Smith mentioned when he talked about our mission and values and things of that sort. We talked about the basic allowance for substances. That's the cost for meals. So that's the $250, $260 a month that we get. And things of that sort. Also, when you do relocate, I've had to do this twice. You don't pay a dime. They come pack your house up. They box all your stuff up. They move you out the door. I mean, you don't have to do anything, and it's special. I don't know if any of you had to move, but I had my share of lower back pain from lifting couches and dresses and everything else. So it's nice to just be able to point and say, hey, this goes over there, that goes over here. So that's another thing that you don't want to take for granted. And the VA benefits, such as the VA loan for when you buy a house. So I've actually taken advantage of this opportunity. What's unique about the loan process, especially the VA loan, you're talking about buying a house, is you don't have to make a down payment. And I don't know if any of you guys are out there trying to buy houses and you've seen what this housing market is doing right now, but it could really deplete your savings if you're not careful. So it's nice to be able to have that advantage. You don't have to use it if you don't want to, but you do have that at your luxury as well. And so I'm going to pause there. I know we've given you guys a lot of information related to history, related to who we are in the Corps and the different career paths you can take. We talked about where we work. We talked about benefits, and we're going to get more into the specifics of the categories that you heard us mention, because I'm sure that's going to be some questions that you guys ask. But we wanted to pause right here and just give you all a chance to ask a couple of questions, and we'll do the best we can to answer. And if I left anything off, Lieutenant Smith, feel free to chime in, sir.
Yeah, no, I think you've covered quite a bit of it, man. Especially the benefits. Like I said, I don't want to bore them too much to death. This evening with the history, I encourage you all to, visit the website usphs.gov. There's a lot of great content down on our site. It's been updated recently, so there's some really good information that speaks to the history. And I'm grateful that you was able to touch on, the benefits, because I know you all are young and we're talking to you quite a bit about some things that maybe your parents, might be mentioning these things to you. Maybe you're already aware of them. As you all kind of going to make that transition, kind of from the high school, and some of you, you're just making that transition onto the next stage in life. These things are going to be real. They're very real. You know what I mean? And so you got to think about the benefits. You have to think about insurance and your day to day and all these different things. I mean, because they matter, and you're going to be up against them. So, so I think you did a great job covering quite a bit of that. So we do want to open it up, as Lieutenant Commander Rush mentioned. If you all have any questions, any comments, you want to put them in the chat. We see there's a few of us, few are still online. So feel free to ask any questions, that might have popped up, as we were going along. And we'll pause a little bit here just to kind of see if we have anything that comes up.
We have a question from Mark. He wants to know, what has been your favorite experience with the Corps so far?
Good deal. I'll go ahead and tackle that, because I mean that actually kind of segues into what we're going to go through in our personal experience. One of the things, there's several things that I have. It's kind of hard to just put one finger on it. But I'm a young man. I'm married. I have a wife and a daughter. I have a family, and serving in the Commissioned Corps has allowed me to handle my responsibilities as a father, as a husband, as a man. My bills are paid. I get my paycheck every month. That's unique. Commissioned Corps officers are paid on a monthly basis. So, my paychecks come in regularly every month. And I'm able to go and take and manage my life and manage my budget, making sure that the bills are paid, and healthcare. I mean, that's expensive. It just is. And so when we talk about low to no cost healthcare, when you get sick, you don't have to ask really no questions. You just go to the doctor. You go to the doctor, you get seen, you get it taken care of. Just as a human being, and like I said, when you have responsibilities, all these things matter. And that matters to me. And I would say that's the personal side there. And then as it relates to service, I didn't realize this. I didn't know it was real until I experienced it. But you all see the different commercials. You probably won't see a public health service commercial, or you may have not seen it. I don't believe I've seen it, but you certainly seen the Army and the Navy, and and they talk about the call, right? Answer the call. And so I was going to go into those branches before a couple of times while I was in college, but I kept getting financial aid approved, so I kept going to school. But at any rate, I can remember coming out of high school, and back then it was I graduated high school in 2006. So I remember Hurricane Katrina happened, and down in New Orleans, and I remember I was watching it on TV. This girl I was dating at her house, they had this big TV, biggest TV I've ever seen, and I'm sitting there watching it, and it's just devastation on the screen. And the only thing I could think of was, man, like I really wish that I could do something, man. I'm in high school, I just felt helpless, but I just felt this desire. Something within me was like, man, I'll drive a bus. I'll move some water. I'll do whatever it takes. I just kind of wish I was there doing something. And so I didn't really know that's what it was at the time. But as I went on into college and then found out about the public health service and realized that, hey, that was, until COVID, that was one of the biggest deployments that the Commissioned Corps has ever gone to. They were out there. I didn't even know it. I had no clue about the Commissioned Corps. So, the ability to put on the uniform and go and serve your country, doing something bigger than you. You don't join government service. You don't join the military. You don't join the public health service. You don't join it to get rich, right? You're gonna make money, and you're gonna have a nice, handsome life. But and I say you don't join it to get rich in relationship to the private sector. You can probably make a ton of more money out there. But when you talk about service, that's a little bit different. It takes a special person to kind of give up what you like to do and what you can do and all these different things to go and say, hey, look, I'm gonna put my life on the line. Sign me up. I'll go do what it is that I'm gonna do, because there's some other people out here whose lives depend on that. And there's some people who just won't sign up, and that's to each his own. That's fine, because it may not be for everybody. But one of the things, like I said, I like about the Corps is the fact that on one hand, I saw this thing and I saw the calling, and I felt the mumbling and the rumbling that was grumbling, within my belly there, in my spirit. And then I was able to participate in it, and I was blessed to get commissioned. And now I'm in the Corps. I'm taking care of my family. I've gone on 2 deployments now myself. And so when you're really out there in the field and you actually know that you're making a difference, you don't have to ask no questions. People may not ever know about, the Commissioned Corps, but I know I'm in it, and I know what my role is, and I know when I'm out and I'm called upon and I'm out there helping and I'm serving, man, it's one of the greatest feelings in the world. It truly is. So, I could keep going on and on about my favorite parts of the Corps. Like anything, there's stuff that has pros and its cons, but, I'll be transparent, but at the same time, it's hard for me to talk bad about it, because it's just so much, the good certainly outweighs the bad to me.
So we got another question from Anaya, and I do want to mention time check. You're coming up against, it's almost 10 minutes of 8. So
Okay.
After this question, we should wrap up. So Anaya wanted to know, what would you say the biggest difference between the U.S. Public Health Service and being a doctor or physician is, other than the benefits?
Oh, that's actually a perfect question. And I can use that one to share my career testimony. So in a nutshell, I'm a pharmacist, not a physician. but still a doctorate, but it's a little bit different. But the story that I'm going to share is going to be applicable to physicians as well as other professions within the public health service. So what the difference is typically when you're a doctor or you're a pharmacist or you're a nurse in the private sector at a hospital or if you have your own practice or something like that, you basically see patients, and that's really it. You may have a few administrative duties here and there, especially if you supervise nurses and things of that sort. But for the most part, the majority of your job is going to be clinical in nature. And that's actually it. And there's nothing wrong with that because there are a lot of people out here who need help. Obviously, you go to the doctor, you're sick, or you have something going on for whatever reason that you need to be seen for. But what's unique about PHS, for example, and I'll share my career journey with you guys, both before the Corps and since joining the Corps, and I think it'll help put it all in perspective. So for me, right, I played basketball in college and I played professional basketball right after college in Germany and England. I got hurt, decided I was going to go to pharmacy school. While I was in England, I decided I was going to go to pharmacy school, and I got home and got situated. And while I was in pharmacy school, I did a rotation with the Food and Drug Administration, commonly known as the FDA. So while I was at the FDA, I saw people going to work in, business suits, and then I saw some people wearing a uniform. And I was like, well, what in the world are these people wearing uniforms for at the FDA? Like, what is going on here? Like, at first it almost scared me because I'm like, is this place, what's going on here? You know what I mean? So I was a little bit on edge. And then as I started asking more questions, that's what my exposure to the Corps was. And so again, that's at the FDA. You're not seeing patients at the FDA, but there are several doctors who work at the Food and Drug Administration. And I used to work at FDA as well, which I'll get to. And so that's when I decided to join the Commission Corps. And my first duty station was with ICE Health Service Corps. So that's one of the immigration facilities. I actually was at the largest facility, and I was the chief pharmacist there. I was the only pharmacist there. And so we did majority clinical work, but also being a public health expert and being a pharmacist and being someone who didn't want to just be a pharmacist, I was able to get credentialed, for example, to where I could see patients just like a doctor did. So I did a lot of psych patients or mental health patients. I took care of a lot of them. I also was able to do like regular routine physicals and things of that sort. So those were two opportunities that I was able to be afforded as a pharmacist that you may not necessarily get on the outside. Additionally to that is you may have a passion for something like infectious disease or HIV or cancer, or even blood pressure, diabetes, something that may run in your family or anything like that. And you can specialize in those particular areas and form your own, diabetes clinics or Coumadin clinics, as you've heard of. Coumadin is a drug that people that are on blood thinners use. They have to get their blood drawn periodically every month. Also the same thing with mental health and certain drugs. So whatever your passion is, you can find something there. But what's also unique is that you can do it on the administrative side where you may be a supervisor. You may, understand more about the research that goes on behind before a drug comes to market, things of that sort. So these are the different things that you have exposure to that you can tackle, that you can jump on and work with. So again, after I left IHSC as a chief pharmacist, again, doing mostly clinical work, my next job was with the FDA, and I was an investigator with the FDA. What was cool about that is I learned how to be an investigator, and not just for the drug side, but just period. So you just like when I watch Law and Order and I watch some of these other shows, I got a whole new appreciation for it because of the skills that I've developed. Even when I'm just talking to people on the street, sometimes I know to ask the right questions to get the right answers. You know what I mean? So it's kind of cool just develop that kind of skill. But again, what was cool about that, as an investigator, I get to go to all these pharmaceutical companies literally across the world, and you get to see various technologies that people use to bring their drugs to market, and different engineering and different science and different things that you have to learn and understand. So you're always on the front end of innovation and things of that sort. So that was also pretty cool. The duty station I'm at now is actually the Department of Defense. And so what I do at the Department of Defense, and Lieutenant Smith does is actually at the CDC, ironically, is I work in what's called the liaison office. So of all the federal agencies that you heard me mention, anytime we have PHS officers that work at these particular locations, we have a liaison office, which liaises to our headquarters within the Commission Corps. And so what we do is we basically look after all of these officers and make sure they're taken care of in their various jobs. We do a lot of more HR administrative type of work. So it's a lot of hiring. It's a lot of awards that are involved with it. It's a lot of maintaining the leave that you heard me mention. Like if someone takes leave for a certain amount of time, I call and check on them, make sure everything's okay, things of that sort. Doing recruitment, like what we're doing with you guys right now to just expose you to these various jobs. We do this all the time. And so when it comes to doing work, there's a plethora of jobs that are out there, from clinical to administrative, to writing papers, to doing research, to doing regulatory affairs type of work. It's truly endless in what you can do. So to answer your question and bring it home, it's endless. That's what the difference is about being in PHS versus just being in the private sector. You pretty much stay in your lane in the private sector, but here you can develop all these skills. Again, I'm a pharmacist by trade, right? And then I just mentioned how I was able to develop all these investigative skills and learn about different technologies and things of that sort from different machinery and things that they use at these pharmaceutical companies. And now I'm even learning the HR side and things of that sort. And that's just not something that you can typically do at a job in terms of being able to bounce around like that. So hopefully that answers your question.
Yeah, and I just want to piggyback on that. And I know sometimes with the chat, it may not be a lot of room in there. The way the question kind of was asked was, the difference between the public health service or being a physician. And you remember, we got to go back to that slide. You have the public health service, which is the main branch. And then there's those 11 categories. So there are physicians and nurses and pharmacists and things like that. So both Lieutenant Commander Rush and I are in the officers in the public health service, but we all have different specialties. And then out of that specialty is a physician or so forth, that kind of thing. So, and like I think the biggest point is that you're not just a physician. You might be a physician and you might be doing clinical. Then in a couple of years, you might decide, hey, I want to do administrative. I want to do research. I want to do epidemiologists and researching and things like that. So that's also, available to you as well. I'll give a little bit of my background, a little testimony with me as well, and then we'll be coming up here, I'm sure, on time. So as mentioned, I'm a dental hygienist. I started out with the Bureau of Prisons, and I told you I graduated high school in 2006. I graduated dental hygiene school in 2011. So I've been practicing for a while. I've done private practice. I've done corporate dentistry. I've done, temp dentistry. And to be honest, I don't feel like it was for me. I used to talk bad about it, to be honest, because, when you're in school, they teach you how to be a clinician. They don't really necessarily teach you the business side of it, because that's not necessarily what they want you to take away. So when you graduate and now you're this clinician finna go out and rid the world of, the way you've been taught, you got to understand the dentist they have bills too. So when they graduate, they got to pay the bills. And healthcare, you just be quite candid with you, it's a business. And so they got to make money too. And so I'm not a salesman, just like Lieutenant Commander Rush and I tonight. We're not salesmen. We might have a recruiter title, but we're not here to really sell you on it. We kind of want to educate you on it, to give you a career path or a different option as you get ready to get out of high school there, or whatever your circumstance is. And so I found the public health service, and I was actually going to go with the Indian Health Service, which was kind of in the Midwest. A lot of those duty stations are Midwest, out West. There are some on the East side a little bit, but not as many. And then I found, I was getting ready to give up my career. And then I decided, hey, I found out about the Bureau of Prisons. And I said the same thing everybody else does, man. I'm not working at no prison. Just didn't know nothing about it. And but I stepped out on faith, and I had an opportunity that presented itself. I was able to get back down to Florida, and I served at an institution down in Florida. And to be honest, it might sound weird, but you got to kind of put yourself in, well, you'd have to kind of know me and kind of put yourself in my position. But, it basically changed my perspective on dental hygiene. It gave me a new passion for it, because now I was out of the private sector into the public sector. I was doing public health dentistry. And so it just reignited a passion within me. And then I was able to commission to the public health service thereafter. And now, I served at that institution for about 6 years, did some really cool things. And I was more than just a hygienist there. And now I'm at the CDC in Atlanta. I'm a recruitment officer, and I'm get to do cool stuff like spend some time with you all as well, and kind of talk to you about an opportunity that I didn't know about when I was in your position. So the sky is the limit. It really is. I know it's a lot of information, and you all will be able to take this with you and kind of process it and things like that, sort through it. And our information contact will be available to you as well. So if you have questions after the fact, you can feel free to reach out to us. We can try to help as best we can and give you some guidance. Sometimes you want to know, what does a typical day look like? These kinds of things are usually questions that come up. So, but it's been a beautiful thing. I don't have nothing bad to say about it. And it's absolutely my pleasure to serve in this capacity. So, again, I certainly appreciate the opportunity. So we're coming
So
up here.
yeah,
go
we're
ahead.
coming up against time, so
Yeah.
I was gonna.
And
do
Kay, if
one
we
more.
can really quickly, because I know
Yeah.
we only got a couple minutes, we definitely want to get a couple questions. But if you could start at about slide 20 for me, you don't have to do the full screen share. I just want to kind of guide them the rest of the presentation.
Yeah, so we'll do a quick.
So what you guys will see here, yeah, it'll be quick, it'll be brief because this stuff is pretty self-explanatory. So again, this just talks about some of the locations you heard me chime in on. Next, if you can scroll down, okay. This talks about a little bit about the physicians. You can keep going. I'll kind of talk as you go slow. Again, these are some of the dental roles. Someone asked about what's the difference in a physician in the private sector versus in the commission court. It's similar to this slide. So again, you got clinical roles, you got administrative roles, you got public health things that you can do. And this kind of touches on that. You can keep going, okay? And that's two of the categories right there. Go down one more with the dietitian. It might be a second one. Yeah, right here. So as a dietitian, a lot of people don't even know what a dietitian is, but the dietitians have a strong role within PHS as well. So when it comes to research, clinical nutrition, public health nutrition, a thing that I like to use on this slide to really explain is some of the foods you eat while you're in school. It starts with someone like a dietitian in the public health service that gets certain things. Obesity is a real thing. And so as you guys are going through these slides, there's more information on engineering, there's more information on all of these careers. But as you're going through these slides, just pay attention to them. If you have any questions, again, you have that thank you slide that has our information. And Kay, if you'll go down below the thank you slide really quickly, you'll see where like here it talks about CDC. There's another slide about FDA. So you can get more of a feel of what goes on at these particular agencies. And regardless of the category that you're in, a lot of times you can handle some of these particular roles. And so that just to give you a little bit more insight and information about what we do within the public health service, those slides are available. And like I said, seriously, feel free to call, feel free to email. Lieutenant Smith and myself are very good about getting back to you. If we don't answer the phone, that just means we're on the phone, but I promise you we'll call you back within a reasonable amount of time. So seriously, if you guys have questions, I know we gave you a lot of information. Feel free to reach out and we mean it. And I just want to reemphasize again, I appreciate you guys' time tonight. It was really a pleasure speaking with you all. And I know sometimes you got to absorb a lot of the information, so you may not have too many questions right now as you process it, but you know, driving to school or something, you may have a question that pop in your head and now you have our contact information. Feel free to reach out.
Absolutely.
Thank you, Kay.
All right, thank you guys so much for that presentation. I know that was a lot of information, you guys. So as always, there will be supplementary material on the website. This presentation will be on the website for you to download so you can go through some of the slides that have different professional roles. And you will get an email from me tomorrow with a link to a feedback survey so you can tell us what you liked and what was good for this evening's presentation. That email will also contain a couple of links, including a link to the health services main page. And as Lieutenant Commander Rush said, you guys can reach out to both of our presenters this evening with all your questions. They are a resource for you. So if you want to learn more about what options are out there, that would be the way to do it. Thank you guys for bearing with us tonight. I know this was a lot of info. And we will look forward to seeing you guys next Tuesday at 6 p.m. We will be covering managing stress and decision making for life skills, and we will be covering emerging careers in computing for STEM. That will include esports. I know several of you guys were very interested in video games, so that would be a good presentation to make sure you attend. We'll also be covering 3D printing and a couple of other emerging careers in the computing field. So looking forward to that for next week. Keep an eye out for my email. And thank you guys all so much for joining us this evening. I'm going to sit for 1 or 2 minutes just in case anyone has any questions, but that concludes this evening's presentation.
Absolutely.
All right, they're typing in the chat. Thank you guys for the presentation.
Okay.
Absolutely.
And thank you guys as
welcome,
always for asking questions in the chat. That always makes it better. All right, I don't see any other questions, so I am going to close the webinar out. Thank you, everyone, and I will see you guys next week.
All right, take care, everybody.
All right. Thank you, Kay. Appreciate you.